And if you can just hold it as straight as you can, that's great. Hold that. All right, so we're gonna do, it probably is 3 centimeters because I think it's grown about a centimeter since it got injected. Hey Sarah, can I just grab some suture too?
Yeah.
Yeah, actually, I brought that back from the, probably just one, I'll get the 3.0 PDS and the 3.0 monocryl and the 3.0 SurgiPro, one of each of those. And then if you can just leave the 2.0 kind of handy. Actually, sorry, open the 2, I'll probably use the 2.0, you can open the 2.0 too. Just one of each of those is great.
So can I ask a question?
Yes.
Here, a bit edematous compared to this one, this whole tissue here. Do you consider expanding the margin?
I think it's because of the, I think it's because of the injection. I don't know.
Oh, okay.
Yeah, I think it's because of the injection though. It's a very reactive kind of mast cell.
And for a deep margin.
Yeah, we're going for this little bit of fascia here.
And then you're gonna include 2 cm lateral margin, or this is the same size as the mass?
For the fascia?
Yeah.
We'll do the same, or I go straight down. Is that what you mean?
Yeah.
Yeah.
Okay.
So just put in some stays just to kind of keep us oriented. It's going to close, or do we need a flap? I got the scissors right here.
Oh.
I think we're gonna need a flap. I was being optimistic. It's always a bit challenging when it's like different fascial planes are coming together. But tumors don't respect to land perfectly over your fascial plane the way you want it to. Maybe just go that way a little bit. Yeah, that's great. Can you call for Sarah? Just need some. Can I get the surgery clips? The ones. You can just twist it for a second. Just hold it like that for a second. You seen these? Did I use these with you? Yeah? Okay. Oh yeah, for the mandible.
Yeah, it's easier.
Yeah.
faster.
There we go. I'm so happy. Yeah. I know. You got to get Julius to use them. Because he was like, how is this better? I'm like, oh, let me show you. I think the lymph node maybe is in here. Should be in here somewhere. Oh, I think it's here. I think, unless that's just where I injected, but I think that's lymph node there. Let's see, I think that's it. There, hey?
Yep.
Yeah. It's small, which is good. Yeah. Yeah, if you want to call someone to come. I mean, it's not urgent, but. almost. All right. Yeah, we need a flap. I think.
Okay.
Sometimes, let's just see, yeah. And just play with it for a second, but
Too big.
too big. It's still bleeding there. Sometimes we can close just a bit, just to make the... All right, let's deal with that, and then we'll... I think we could close just a little bit, which is good, because then you don't need as much of a flap.
Yeah.
All right. Let's lavage, and then... Ready?
Yeah.
All right. Let's just close like a little tiny bit. If you want to hold that, we'll just close a little tiny bit, and then we'll switch our gloves. Just trying to decide if it's too tight. Yeah, I don't like it.
Where's that one?
That one. Okay, give me this for 1 sec. I'm going to take this out. You want to hold that? Going to close even less than I said. Yeah, that's better. And then we're going to have our flap come through here. Oops. All right. I'm just trying to decide if there's any other more local ways, but so there's a skin fold flap, but I don't think it's going to go down there. I don't think it's going to go where I want it to go. So, okay, would you be able to call someone? Just need a bunch of stuff. Hello, can we just need to change our gloves. And then I'm gonna need a few different things. This is everything we used here. Okay. And then we just need a few things. We're going to need a new cautery and a new scalpel handle and a number 10 blade. Number 10 blade, yeah. Yeah, we will readjust that. Great. And then can I also get a new pair of suture scissors? No, we only have one sharp blunt, I think. Like I already used them. I used them once. Yeah.
Will you use that with it too?
Yeah, we just won't use it. Thank you. I think we just won't use it. If we need suction, we'll just. And we'll get some new lap sponges too, please.
Additional 5. Thank you.
Do you mind calling her again? Sorry. We should look for our inguinal node when we're here. I'm sorry, can we also get a 9-inch pain catheter and the PRN? And then I'll just give you, just so I don't lose track of my lymph nodes, just give you a lymph node. Am I plugged in? Oh, I don't think I am. My new, yeah, I don't think my new one is plugged in. Yeah, it's, is it?
I don't think so. It's old one.
I'll come around.
Thank you.
The new one's blue. Sorry. Thank you. Thank you.
Thank you.
Are those clips buildable? Yeah. Those are them. It's just a one. I don't think they're on our meeting. I don't think I'm on the end, but then there's the application. Yeah.
Thank you.
Was she blocked up here?
Yes.
Yes, okay. She just seems like she doesn't like it. She's like, okay, maybe.
No, she had a bilateral QL.
She did, okay, okay. This cord is not like me. It's like, it's tight.
Needs to come from your other side.
So you got to stay below the, you can see the vessel there.
Mm-hmm.
Got to stay below it. This is a nice flap. It's probably my favorite. This and thoracodorsal, my favorites.
Do you always take a bit longer?
Yeah,
Just in
yeah,
case?
just in case. I was debating it, but there's nothing worse than
I see.
if you get there and then you're,
Uh-huh.
yeah, it's always like you need the flap the most at the distal part of the flap where it's more likely to die. It's very frustrating, but yeah, so I kind of measure, it stretches too, but yeah, I always take it a bit longer than I, just in case, yeah.
Maybe the worst case scenario is a bit
You take
short. Short.
the worst case scenario is it's a bit short. Yeah, you've done all this and now your flap's not where you need it.
Yeah.
It always strikes me as so much work just to get a little bit of coverage, but and they have nipples on their hips. We call that nipples
Yeah.
or hipples.
Okay.
It works both ways.
Works both ways. Oh, you know what I should have done? I didn't do. Just keep this. Keep that a little bit happy. Yeah.
So how do you decide the width of this flap? It depends.
The
on
width?
Width.
The width is based on the anatomy.
Okay.
So you go midline to the nipple and then the same distance on the other side. Yeah.
Regardless of the side of the feet. Right?
Yeah. So sometimes you have to kind of curve it around itself. But yeah, I know it won't. That's about how much it will feed. So wider is. Well, some people do a hockey stick or something at the end. So you could probably go a smidge wider, but.
Yeah. And did you call this Boston flap?
No, I didn't name this. This is named the caudal superficial epigastric.
Yeah.
This is named after the vessel.
Okay.
No, we can't claim this one, Shogo.
Okay.
I like it though. I like this flap,
Okay.
but no, it's not mine.
Okay. Well, let's change the name of the flap.
Change the name of the flap?
Boston
Okay.
flap.
Yeah, no one will mind.
I think we know.
Yeah. But nothing's, I don't see any blue.
No.
So maybe that was the Sentinel.
And did you inject ICG?
Yeah, yeah, so we could put the camera on it quickly. Do you mind calling someone again?
Dr. Jess.
Hello. Do you know the camera for the ICG?
Yes.
Are you able to grab it?
Yes.
Thank you.
Does the ICD require a certain amount of time to get to the results, or is it?
It's pretty quick, like a couple minutes usually. I don't know, like on our, if you base it on the CT stuff we do, it's like 3 minutes or so. Oh, look at that. You can see a little bit of blue in the, oh, or maybe,
See it?
I thought I saw some blue. If you want to start, actually. Gotta close this from you. I'm going to suture this in, and then we'll. Oh yeah, it's all in.
Maybe we need to go.
We can just.
Okay.
Yeah, we'll just fold it on itself a bit. I think there's some surgical there, and then needle drivers here. Yeah, I'm ready when you guys are ready. Let me just. I think that works better. So I'm kind of want to focus on this area here. I'm kind of looking for the inguinal lymph node. Maybe we need, I think the light, can you turn those off too and just see? Oh, okay.
What's happening?
Everything but the flap is not, that's interesting. Can you do one other thing? Just put it on this. Just, yeah, that lights up. Okay.
Okay.
All right, one more try. Just kind of right here. I just don't want to dig too much in my flap because I don't want to make it mad. So I think we're going to. It's not lighting up where I thought the node was. It's interesting. All right, we're going to let it go. Thank you.
Thank you.
And then it resets it too. Having both sides off helps the lighting up. Yeah, but like the which way do I go? That way.
Thanks, guys. Actually, while you're here, do you mind just popping that into a formalin jar too? You can just kind of sneak it off the table. That is the left popliteal. No, we didn't get the inguinal. Left popliteal, yeah. But the inguinal's not lighting up, so I kind of think it's probably not Sentinel. You know what I mean? Like I think that one's a Sentinel because it lit up and it was blue, and this one's not lighting up, and I don't see any blue. So, and I really don't want to dig around on the flap because you can, as you can imagine. So if you want to start, I think that's 3-0. If you want to start closing in 3 layers. Got lots of work to do here. Are you happy to do that?
Yeah, 3 layer. Yeah.
So I would do what I'd recommend. Just do from here this way.
Yeah.
But I would start with just like maybe cruciate, like deep sub-Q.
Okay.
You can kind of start off in between all the towel
Yeah.
clamps just to take the pressure off, and then you can take the towel clamps off, but just do a kind of an interrupted from here up of the deep sub-Q.
Okay.
And then we'll do a more superficial sub-Q and then skin.
Okay.
And I'll work on this.
It's maybe 2 or are you okay?
Either one's fine. I think it's 3-0, but I'm not sure.
Okay.
Yes, sure.
And
Uh,
then maybe we need horses.
oh yeah, we do because I have a pair, and then the other ones are. Actually, I can probably switch you though, in a second. I can give you these because
Oh.
I'm working down here now, so it's okay. Yeah,
Okay.
we're okay. Sorry.
Okay, thank you.
We're just doing a clean to dirty instrument switch, but I can use these now because I'm down in the. Yeah, that's great. Thank you. So the other thing, Sugar, you don't want it to have it has to curve around on itself, but you don't want it to be too kinked. So we'll just kind of let it have, probably go like, you know what I mean?
Yeah.
Yeah. Like that, maybe.
You have to make it loose around here.
Yeah, like just you don't want it to be a super, it has to go back on itself, but you don't want it to be super tight.
Okay.
Do you mind just calling for some suture? You mind grabbing some? If I can get, what are you working with? Is that 3 or 2? I think it's 3. 2 packs of 3-0 PDS on a taper.
Is this our clean stuff here?
Yeah.
Oh, Sarah,
Yes.
I'm stealing. Oh, you have stealing.
I have my own.
Okay.
Yeah, I have my own. Because I'm now I'm back in the tumor,
Okay.
so I can use the other instruments that we were using before.
Okay.
But you're the clean person.
Good. Julius is holding Caesar like this.
Yeah?
So I'm mimicking it.
Oh, okay.
Yes.
Nice. It's actually not too long. It's perfect. It would have been too short. Then we would have been very sad.
Did you make bridging incision?
Yeah, so yeah, sorry, I didn't tell you that. I made a bridging incision.
Here to here?
Yeah,
Only one?
yeah, just one incision, and then it just kind of opens up.
So upper knee is always creativity
For what?
to,
For flaps?
yeah, flaps.
Like, what do you mean?
To build a free,
Oh, to make them nice?
yeah, reconstruct the defect.
Japanese do that?
And I think so.
What about Canadians?
I think so.
What are you saying, Shogo? The Japanese do this better than me? Maybe. Maybe they do. It's okay. I brought in someone from Japan to
Oh.
help me. It's perfect.
Boston.
Yes.
We have been waiting for you to say something
I
funny.
know, I know. I think the camera makes me, or the, have you noticed how quiet I am? Never been more quiet in surgery.
You're quieter.
I'm so quiet.
Yes.
It was like, I want to start telling stories, and then I stop myself. This is when we talk in surgery though,
Yeah.
because we're just closing everything.
Yeah, close it. You are quiet.
It's a talking time, but it's where I tell you lots of stories.
The audience is here to listen to it.
I know.
Yeah.
Julius. I was thinking how nice it is to have a surgery intern, because doing these flaps on your own is very longer surgery to close everything yourself. So that's what I was thinking about when I've done that. You get very tired from closing like all that, especially if it's a big dog. Like I've done these in like mastiffs and stuff all by myself, and I get tired and sad. Tired and sad.
Can I have another suture?
You know what? We're gonna need a. Or do you mind? Hello. Do you mind giving us a bunch of stuff while you're here? Okay. We might as well get. I'm gonna need more. You can give us 2 more packs of 3.0 PDS. On the sink? I love it. So funny. When did that go up? It's excellent. It's excellent work. I approve. It made me smile.
It's going to be a weekly thing
Oh, okay.
to look forward to.
I love it.
Thank you.
What else do you need?
We might as well get another 2 packs of 3.0 monocryl on a cutter, and then another 3 packs of Proline. Sorry, 3.0 Proline on a cutter.
Do you want me to go the second layer or keep going?
You can either, yeah, you can do a couple more. I just wanted to kind of get started with the, let's see. I just don't want to stress you out with the flap. It's a lot of responsibility.
I thought this flap is a bit long, but good size actually.
Yeah.
Yeah, fitting it.
Sometimes when you take the kink out, you waste a lot of length, unfortunately, or fortunately, I don't know which, but it takes up. Oh, that's not helpful. Just a little bit dry there. You can go from here that way, and then you can do your.
Good.
Thank you.
Thank you.
What are you working on?
Are you joining us or running away?
I was going to join Leah since
Yeah.
you're in here.
Yeah. What's Leah doing?
She's
TPLO?
doing an anal, sacronexium,
Oh yeah.
and then TPLO.
Yeah.
All right.
Doing MCL, I don't know if that happened yet.
All right.
Yeah.
Oh, sorry.
The second layer, I'm gonna use simple continuous.
Yeah.
pattern again.
Yeah, I think that's good. You're just using this to take the tension off.
Yeah.
Yes.
Yeah, maybe. Can I borrow it, please?
Yep.
Thank you, Sunny.
You can have more of it if you need it. Share. Hello.
Hello.
How's it going?
Good. How's this going?
Really good. For lymph node, we have the left popliteal.
Okay.
That's what we're submitting. And she has a pain catheter. We use Surgiclips, no ligature.
What size surgical?
Great question. Sarah Leduc will know.
Okay.
Yeah, sorry. It's not, I don't have the package. Actually, hold on. The 11, the bigger ones.
Okay, cool. And no changes to the plan of anything?
No, I don't want them to, do not ice, like,
Yes.
no icing of the flap.
Yeah.
And I don't want her on a dexmedetomidine. I don't want her on dexmedetomidine post-op.
Okay.
Um,
Like if they need to give her a bolus?
No, no. It causes
Constriction.
vasoconstriction and it can affect the flap. So they can use, you can put ACE promazine orders if she needs it, or they can give her trazodone, but no dexmedetomidine, no meloxicam, no dexmedetomidine.
Do you think I can go skin? I haven't tied it here, but
You
it's
can go to here, and then yeah, then you can do skin. I'm trying to think of anything else. E-color is like not optional. She's not super stressy, but I don't know, her personality is very like, she's boisterous. So they may need trazodone with her. She's on fentanyl, ketamine. She can start gabapentin. She's on her fluids.
So no meloxicam?
No meloxicam. No. And she can stay on antibiotics while she's here.
Are you gonna use acetaminophen?
Oh yeah. Oh yeah. Thank you. Yeah, let's do that.
This is why we keep going.
Yeah, let's put her on acetaminophen. As soon as she can take oral meds, she can start that. I do the wimpiest dose though, you
10
know.
to 15.
I do 10. I do 10 Q12, yeah. We do?
You have to do the whole bag though, or something. Like you have to. Yeah. The bag goes with the patient. I don't know cost-wise what it is. But
Do you want to just investigate?
sure.
Because it'd be nice to get it in there if we could. If it's not too much, yeah, we can.
How many days?
She can have 5 days.
It's the bag itself is only 50. The whole bag.
Okay, let's do that. And then she can just have her first maybe have her first 2 doses as an injection. Okay, yeah, that's great. I didn't know we had that. Thanks, Shogo. That's what I was starting to do that. So the reason I don't do an NSAID, Chrissy, is because some of these dogs with, they can have increased acidity in their stomach because of there's like, sorry if you know this, there's like histamine 1 and histamine 2. Do you know that? Yeah, okay, sorry, I don't know if you know that. So yeah, I don't tend to use NSAIDs with my mast cell tumors. I know some people do, it makes me nervous, but it's a good point Shogo makes since we started using acetaminophen. I've been doing that for my mast cells.
Okay, I'm gonna skin.
Okay, if you want, you can do like a forward interlocking, like little spurts of,
Okay.
it's up to you. It's a little bit.
Is it okay to use Shogo's locking?
Shogo locking, what's
Yeah.
that? Is it special?
No.
Okay. Shogo locking. I want to see it. But don't do the whole, like do little bursts and then do intermittently, like tie it off. So it's just, you know what I mean?
Okay.
I'm going to do something similar back here. It's just,
So that ER doesn't complain.
oh, do they complain?
No.
Oh, if
dog,
if the dog has
eats-
to come back.
eats it,
Yeah,
yeah.
eats his suture, yes. Yes. I do a lot of continuous with the flaps just because it's so much suturing, so long, you know?
Yeah.
So. So I had a friend who's an anesthesiologist. I don't know if I told you this story. He did a study on rabbits and skin flaps with dexmedetomidine.
Oh yeah.
And he didn't publish it though, but the rabbits that had dexmedetomidine, their skin flaps died.
Died.
Yeah. So, yeah. Just because if they have prolonged vasoconstriction. So.
Yeah.
Yeah, they're tricky all around, but the ones that didn't have the dexmedetomidine lived. Like it was like a, yeah. Always with the flap, I'm like, don't ice it, don't rub it, don't clean it, don't touch it, don't look at it. Just look at it from a distance. Yeah, exactly.
Matt's recommending 10 to 15 milligrams per kilogram per week.
Acetaminophen? I go lower. I just do 10. It just makes me nervous. So I've been doing 10 10 Q12. It's just because I'm nervous about it. I need to get more comfortable with it. But
He says if it was going to be for longer than 5 days, it should be dropped to Q12.
12. Okay.
You want an hospital IV Q12?
Yeah. Yeah. I'm suturing backwards on camera.
Oh god.
I don't know why I did that. I set myself up. suture soon?
Yes.
Sarah just confirmed Owen said acetaminophen 10 mg per kg IV Q12, ketamine 5 to 10 until discharge, fentanyl until 3 hours prior to discharge, no dexamethasone, no ice.
Yep.
Non-dissolvable skin sutures, left ocular lymph node, and left polycythemia mass. 90 mils per day for PLA.
Yeah, until 8 p.m. and then I bring it down to maintenance. Yeah. But those values, there's like, I mean, I can get Jen or Shoko to put it in. Are you putting it in the treatment or are you putting it?
I just put it in our checklist.
Okay, because there's like ranges that I have for the CRIs, but I think,
Yeah, they're under, they're like 5 to 10. We usually have them at, and then 1 to 3 for maximum, so. And then you have a little
blurbs.
blurb.
I have blurbs, yeah, just to help people adjust what they need. Jogo, I'm tired. Can you finish up? Good, thanks.
Chrissy, are you aware of any transfer? No transfer so far.
Not yet.
Not yet.
It's not the witching hour.
I know, that's the thing.
Soon.
Soon.
3 o'clock.
That's the witching hour.
That's the witching hour. Actually, lately it's been like 4 That's the thought crosses your mind that maybe you'll leave on a little early.
Yeah, don't do that.
Why did I think that had
I have to get ready for my trip. So I won't think about that either. If you want to follow my
Okay.
suture. Now, the only thing I'd say,
Yeah.
actually, I need to show you something. Do like a couple interrupteds there, and then I'll show you something.
Sure.
We still have to do the other side. I just, like the other side of the flap.
Interrupted crochet or just a simple interrupted?
Crochet's fine. I just do something a little bit different. I don't do forward interlocking on the flap, but I'll do a continuous on the flap.
Okay.
I don't like to come too far across the flap, you know, if that makes sense. Because you could be squishing its blood supply.
Yeah.
So yeah, I'll just show you, and then. But I still need to do a string of sub-Q here. The flaps are a bit of a project, hey? Like, it takes so long. Do you mind calling for suture or giving a suture, either one? Might as well flip us 3 packs of 3-0 proline on a cutter. Thank you. Okay, Shoga, I'm going to show you, and then you can do it from basically from here to here. You may need to put a couple interrupteds there, but I'll just show you what I'd like to do. And then I'll work on that while you're doing that.
Okay.
And then we still have to do the other side, yeah. So, I always, just because, hey,
Hello.
a lot of people don't do, what's up?
I just want to confirm, are we just sending the popliteal lymph node?
No.
Or the inguinal too?
Oh, for lymph node, no, the inguinal didn't light up for us, so.
Okay.
But yeah, just the mass and the popliteal, yeah.
Okay. Then you have to ink the mass?
I need to ink the mass, yeah. So you can take a bigger bite on this side, but on the flap side, just like a relatively small.
Okay.
It's just, that's why, I just don't want it to be, so you don't have to do forward interlocking, you can just do a continuous, but don't pull it tight.
Okay.
You want to keep it actually
Gently.
just gentle and kind of loose. So,
Okay. What's the difference? Like
I'm not locking it, I guess. That's it. That's the only difference. And then so the reason for the locking is like it sort of stops you from making it too tight. But I think if you just do little bursts and intermittently tie them,
Okay.
I quite like it for flaps. I don't know. I think it works well for a flap, maybe because it's so
simple continuous.
simple continuous on skin. It seals it too, which is a nice thing about the continuous suture patterns. It kind of seals everything off.
I've
Yeah.
never seen forward interlocking in Japan.
You never seen it?
No.
Oh, really? Do they do continuous on skin there?
They do. I have seen simple interactive or simple continuous
On skin?
on scene.
Oh,
I'm
I don't
never
think- I
seen-
don't-
Yeah.
oh, really? So people do, is it common? That's interesting.
I think I worked at 4 hospital, but
Yeah.
I have only seen simple interactive or simple continuous. Not.
But is simple continuous on skin is common?
Yeah.
Because it's kind of something that people don't really do here.
No. So different.
Am I secretly Japanese? Maybe. I've always thought that. Yeah.
Yeah.
It,
Yeah. Actually, I don't know.
I think it can be quite nice.
Yeah.
The reason for the lock is it sort of helps it keep loose, because this you could make it really tight. But yeah, so just do. But I like it for flaps. It works well for flaps.
Okay.
So go for it, and I'm gonna do I haven't done my sub-Q yet, and then we have to flip over and fix the other side, but it's too hard to do it. Very quiet, yeah. Sorry, it's the quietest. Maybe you guys will always want to put the camera on when you put the microphone.
so that's
So I'm quiet. It's the only way to. It's the only way. It's the only way to keep me quiet. I was thinking Julius would be watching this, but he's in Colorado.
Colorado,
So
yeah.
it's not probably.
Is he coming back tomorrow?
I think tomorrow. Oh, maybe today. No, maybe tomorrow. I don't remember. What'd you lose?
Needle holder.
Uh-oh.
Can I hold on a bit?
Needle driver.
So it's very satisfying when they have to go to another room after.
We're good. We're almost there. We just. If Shoga wasn't here, I'd be a sad person. It's a lot of suturing these flaps.
Yeah.
Is there a difference that fell already, Sugar?
Hmm?
good.
Yeah.
Just have to. It's actually more than you think on the other side.
Thank you. I got a note.
Got a knot. Okay.
How's camera? Is the camera looking at my head?
It's
or-
a little bit your head, but it's okay because we're gonna shift it soon. You know what? Just tie it there.
Yeah.
Just tie it there, and then do a little bit more.
Yeah.
Okay, do one more and then tie it there. Just one, hey?
Yeah. Thank you.
And then just go to like here, and then we'll flip it.
Yeah.
It's happy right now. Well, I don't think I'm going to help you to trail it. No, no, it's too short. That's really cool. They do that in Japan.
Japan.
Yeah, because it's just weird. Like people say never do that. It's like, why?
I've never seen it. Yeah.
Like no, but in
Mhm.
North America they say you don't close skin like that. It's a great way to close skin, I think.
I was thinking
It's all sealed.
maybe size of the dog.
Oh.
They do
So
with
many little?
lots of little tiny
Yeah,
dogs
in Japan.
in Japan.
Yeah.
So maybe just simple
Interrupted.
interrupted.
Oh,
would
because
be-
they're tiny.
Yeah.
Yeah.
Oh, you can see it. Where I see.
Yeah. Just tie that off and then we'll flip it.
Yeah. And cord locking.
Yeah.
One surgeon said it's from that technique is from large animals.
Yeah. A lot of large animal vets do that.
Yeah, and then just that he doesn't like the tension on the skin.
Oh, really?
Yeah, that's what he said.
That's funny because the whole point of it is that it takes some tension off. But I don't know. Everyone has different.
Yeah. Thank you.
All right. Can you hold like that? Okay. I don't usually do this, but I just couldn't get the. You were like busy, so I was like, I just want to make sure you don't want to come on the other side and realize you have your flap in the wrong place. You know what I mean? Do you mind grabbing us more suture? Maybe 2 packs of 30 PDS.
Want it cutting?
Taper's fine. Uh-oh, what's that? Sorry, I just want to make sure this is. Thank you. Is that just my knot? Oh, it's just my knot. Okay.
Yeah.
Sorry, I was just like, make sure it wasn't cut. Take this out.
question for you.
Mm-hmm.
You never use big bite on the skin, or depending on tension on the skin.
I don't think I. Are you asking, or did you notice that?
I'm asking.
You're asking?
Yeah.
Definitely not on my flaps.
Okay. Not flat. Just normal pressure on the skin. Do you, depending on tension, sometimes you?
Yeah, I don't like big bites though. I would say I don't do huge bites.
Okay. Small bite.
Small bites. Sore?
My neck is. Yes.
Yeah, I know. These and all the surgeries I do are really bad for your back. Like maxillofacial stuff is bad because there's no good position, and then this is bad.
Yeah. If I remember correctly, there is a literature on how surgeons get tired after laparoscopic surgery,
Yeah,
or maybe you can quote how a surgeon gets tired after.
flap. Well, it's tiring because it's also just very repetitive. Like once you get everything set, you're just suturing and
Yeah,
yeah.
but I think there's no.
No one cares.
Yeah,
No one's written a paper on it.
no
Let's do it.
Take home, maybe conclusion will be different. Maybe people say so what.
Well, yeah, but I think a conclusion would be have two veterinarians working on it
Mm-hmm.
because what you're doing is super helpful. So I think there's a conclusion.
Conclusion. Did you say you do yoga?
Yeah, I'm not enough, but yeah,
Oh,
it's-
yeah.
it helps. But yeah, not enough yoga. Oh, I don't want to be into my flap. Doesn't look very good. I'm gonna fix that. Yeah, flaps are tiring. It's a tiring surgery.
Oh.
Hundreds of seizures.
Just hundreds and hundreds of sutures, yeah. But then if you don't take the time, you kind of pay the price later. You pay the price. Sometimes we pay the price even if we didn't need to pay the price. But yeah, it's. I was thinking, I'm like having funny thoughts in my head that I can't say because I'm on the. All right, there's a way. Hold on.
Oh, like that?
Yeah, just let him be attached to this for a bit because. Yeah. Okay. So if we were going the opposite ways, but just wondering if there's a way we can both. If I'm here and I start working this way, then you can follow with skin.
Okay.
Does that sound like a plan?
Yep. me see. Can I have another proline? 2 proline.
2 more.
Yeah.
Yeah.
You guys want to do a box, probably.
Yeah. It's crazy.
Okay.
This is a home stretch, though. Just let me get a little bit ahead of you, and then you can start following me.
Great. But today is almost done.
Today?
Yeah, today is done.
No, what time is it?
Stuff showed up.
It's now 11:55.
11:55, and my day's almost done.
Yeah, almost done.
Here, we'll find something, don't worry.
Tomorrow is waiting for us. Oh,
Tomorrow is waiting
oh,
for
you're gonna go to California.
I'm going to be going to California.
Phil
Yeah.
and Jeff are both coming.
This is, you're going to have to do like an interrupted something here.
Okay.
So it's like a little. Yeah, so when you start following me, do like this whole business here, like this whole thing here should probably just be either cruciate or interrupted.
Okay.
And then starting here, you can do
Okay.
that business. Yeah. Oh, you think you can get it from that side? Hey, we switched sides. That was funny. Ha, sorry.
Okay.
Pushed you out of the way.
Oh.
It was meant to happen. Yeah.
Happens very naturally. So the best kind of surgery is when you and your assistant just do things.
I
together,
know.
you talk,
It's lovely.
so nicely.
I used to always say that about my fellows. We would get to this point where we didn't have to talk to each other. It was cool. Yeah.
The doctor I worked with in GP before.
Yeah.
What do you want? Before he did.
Ha.
Do you often go give a lecture in North America or in other countries?
Yes. Yes.
Yes.
More. I did more when I was in academia,
Oh.
and I would say I did more when I was before the pandemic.
Mm-hmm.
But yeah, this isn't a serious lecture though.
Oh.
It's not even a keynote. I thought it was a keynote. It's not even a keynote. It's just jokes. Just jokes.
I still think the two together would have been entertaining.
Well, I know something like that might happen, or I might just intermittently. I liked my keynote. I had all these really cute stories about cats.
Well, you can save it.
Yeah, I'm doing another keynote in April, so I'll just do it then.
Oh, it's ACBS.
No, April's
April.
April, actually, it's just a thing in Toronto. It's not
Oh,
anything.
Toronto.
Yeah.
Oh, yeah.
Well, it's a group that Michelle Lem is involved in, but I can't. It's like a community vet outreach. That's what it is. Which is also called CVO,
Oh, CBO.
which is confusing because it's
Yes,
different.
yeah.
Different,
When they first asked, I thought it was the CVO, but
different CBO.
different CVO. Yeah. So I'll do it then. I want to do more keynote stuff. I like it. I feel like it combines some of my skills, but not this week. I don't get to do it.
Not this week.
Not this week. See the nipple there?
Yeah. I can see that.
Guess what, Chrissy? Guess what we need? Yeah. Can you believe it? 3.0, at least we're on the last layer. 3.0 proline on a cutter. 2 packs, I think. Well, maybe just open 1 pack. Just open 1, but maybe have 1 ready, just so I don't waste it.
Okay.
Oh, I got to show you something. Do you know what split thickness is?
Split?
It's called split thickness. Here, I'll
Okay.
show you. You can practice. So see how this is, if you do suture here, it's pretty even, but here it's not even. So you go
Oh, deep.
deep here,
And then more superficial.
and then more superficial, like kind of through the, you know that?
Mm-hmm.
And-
It's, in my understanding, that's a Boston technique.
There you go.
Yeah.
Yeah, I invented it. No one else ever thought of it before me.
We're gonna get something named after you.
I know, I'm trying. Shogo's trying to help me out. Can you do that while I do this? Are we going to get in each other's way?
Sure.
I kind of switched it to doing cruise ship for some unknown reason. I must have a reason. Just seems to be working. Oh, do we need the other one?
Oh,
We need the other
yeah.
one. Chrissy has it.
Pretty.
Sorry, Chrissy. I should
That
have.
one? I brought several.
Thank you.
We are actually almost done.
That's okay.
You have the pain catheter on the instructions, right? This one?
I believe so, yes.
Okay. Is Tater going home today? I guess we can't talk about other patients. Is your, okay, scratch that. Don't say that. Your
Dog one.
dog is going home today. I didn't think about that. We can't talk about.
Yeah.
Is that your long-term patients going home today?
I think that's a plan.
Yeah, that's
Really?
great. That's great.
Exciting.
Yeah.
We had a good play yesterday.
Aw,
Yeah, we have to retrieve the secret caster.
yeah, I know.
Yeah,
I know. That's okay.
secret.
Have to see what happens because
And so you're, bupivacaine 0.1 mg per kg Q6 in the pain catheter?
it's actually one
Oh,
micro
sorry,
kick.
one.
Yeah.
Sorry, yes,
Yeah.
there was one I just wrote.
Okay.
Well, I like to think it's like that.
Yeah, he's been here for 3 weeks.
Yeah.
Yeah,
Good that he gets to go home. Poor guy.
poor guy. But he's getting used to this environment.
Yeah.
Yeah.
Dogs are amazing. All right. I'm going to let you finish that. You can do, you might as well just do cruciates though, hey? A couple more cruciates?
Sure.
Okay.
Thank you.
Thanks for all your help. Thanks for coming in.
Thank you so much.
Uh,
Are you taking position?
Yes.
Got it.
Okay. You good?
Good.
Okay, you're good, Chrissy?
You're good.
Okay, oh, let me count. Let's do that. Yeah, 1, 2, 3, 4, 5. Hmm.
Did Andy get handed off with the mask?
Well, the mass is there. I think I've got 3. There's 1 on the ground. Let me try again.
Show me your height when you did it.
2.
Is the mask up here now?
No, the mass is here.
Maybe another flap.
Yeah, I don't think so. There's 1 on the floor. I don't know if there's another one on the floor. Oh, yeah, there's 2 on the floor, so we're good.
Oh, one there.
All right. Okay, I'm going to go ink.
That's 10?
That's 10. Yeah.
Perfect, thank you.
Yep.
Thank you.
All right. Thank you. If you do cleaning, Shogo, don't, like the flap,
Gently.
gentle. Yeah.
Dabbing only?
Dabbing only. And yeah, just, like you can clean here more aggressively, but anywhere on the flap, I'd say just don't even clean it. Just leave
We're
it.
putting 5 teaspoons over this?
No, just on the belly, not on the flap. Yeah, because I want to see it. So, and I don't like stuff. Actually, can you put that somewhere? Because I have had a flap that they stuck stuff on it too. Yeah, thank you.